Today, I'm talking about something that very few people are focused on, both in the medical and the scientific community. And it's sad that this topic is getting such little attention. And actually, when I did some research around it, when you look at keyword searches and so on, nobody is really interested in COVID. So I appreciate the people who are here with me and who have been with me, but that interest is falling quickly. COVID is now a term that nobody wants to hear. But that's actually what's concerning me the most because in reality, I suspect that if we don't get our head around this, this is going to become a big issue in the near future. Now, I've been focused on it for a long time. And when I look at the data, this is what I've been seeing with what changed after the pandemic. And so I know that something isn't right. When we look at all the age groups, you can see things like cirrhosis of the liver is rising almost 100%, toxic liver disease. So children are being affected by liver abnormalities. 18 to 29-year-olds, the primary thing there is disorders of mineral metabolism as well as liver problems. When we look at the 45 to 59, top is hypertensive heart and renal disease. So something isn't right. And the problem is that there seems to be very little interest in trying to understand what's going on. But someone asked me a question just today, and this is what triggered me thinking about it. Okay, how can I explain what I think is happening and why it is happening? And this is what I'm going to try and go through to try and see if I can make sense to you all to understand a little bit more about what is going on and why I'm focused on it. The first thing that I'll do is give you some context. So, when I'm speaking about it here, a lot of people, when they think of COVID, they only think about severe COVID. But I usually make the example of varicella zoster. Now, this virus causes chickenpox usually in kids. This is what it would look like: fever, itchy rash, spots all over. The same virus in older people, when it's a reactivation, this turns out into a completely different presentation. And so, if you didn't know that these were the same diseases, so to speak, or the same virus causing this, you would think that this is a completely different disease. This is the point I'm making. People don't quite understand the issue that what we saw early in the pandemic is not really going to happen that much. Now, this is where I have one of the differences in view with, say, Gert, because Gert believes that we're going to see quite a severe presentation in Hivicron. Now, I think that Hivicron is actually here, a highly evasive immune variant of a virus. I think that's here, but it's just not presenting in the way that we would expect. So when I look at this here, again, when we compared it before, same virus, different disease, this is severe COVID, which was primarily a respiratory illness with inflammation of the heart, blood clots, and neurological symptoms. This is what caught everyone's attention. On the other hand, the long and chronic issues with regards to multi organ impact, chronic systemic disease, abnormal patterns in different organs is where we are now. It doesn't present in the same way. And what people don't quite understand is that when we think of what is going on and how things are presenting, if we don't get this right, if we don't get some good understanding about it, this is going to explode in a way that we can't predict. And this is why, as usual, I've been talking about the COVID storm. And this is essentially what it is that even today I'm focused on now is that principle of don't underestimate reinfection. Prior COVID infection, prior vaccination, reinfection, you get like a completely different presentation of disease. This is what I call the COVID storm. So, this was where the question had come from. And what the person had asked me was whether or not they were at risk of that kind of response. And I was trying to find a way to answer it, to make it clear to them. And this is why I came up with this kind of explanation as to what I think is happening. And I'm going to show it to you, and then I'm going to try and break it down a little bit better so that you understand it. So let's take the essence of the point quite simply here. Who is at risk for what I call hyperimmune responses on re exposure to spike protein? That's really the question. The first group is, in my view, the most obvious group, people who had severe or moderate to severe COVID 19. They were in hospital, they survived it, they came out of hospital. Now, this indicates that their immune system is already primed. So, this severe group is one that I had always thought they should have been cautious with regards to vaccinating because they already had natural infection. They already had a hyperimmune response. Why are you risking them having another one? That was my point. But the problem was is that the community didn't quite agree that the spike protein was the problem. Hopefully by now people understand that this is the issue. If you don't, that's where we're going to get into trouble. So the next group that I think is very important to understand, and this is where the question probably comes from, is what I call the hyperresponder, the vaccine hyperresponder. These are the people who had very strong immune responses post vaccination. I consider that an adverse event. Hypermetabolic lymphadenopathy. So they had extended lymph nodes, prolonged immune symptoms beyond the normal time frame. This would suggest that their systemic immune system was primed. That was another cohort. And then there is this cohort who are also systemic primed, but they have mucosal barrier failure. That means that their mucosal immunity doesn't work very well, and they keep on getting reinfection after reinfection. That's an important point that I think needs to be understood. So here is how I put it in a way that makes sense to me, and hopefully it will make sense to you. Once your immune system is primed, you then have to worry about what happens if a virus gets beyond your mucosal immunity. So it's not just infection, it needs to be systemic infection. And here is how I use the analogy. On the left here represents strong mucosal immunity. The castle walls are in place. They have lots of artillery on the walls. They have a gate. They have a moat. You can't get in that easily. So even if this person had severe COVID, but they were left with strong mucosal immunity, they would largely be protected because the virus does the damage when it gets inside the gates. Okay. Conversely, on the other side, you have weak mucosal immunity. Now, this is where what you've done is that instead of having a castle wall, you just have a fence. And what you've done is then you've put lots of soldiers in. And this is what I call systemic immune priming, right? What we do with vaccination. So you have lots of antibodies, lots of immune cells, but they're within the castle wall. And so they start fighting and doing damage within the castle wall. Because this is the point many people don't grasp. Most of the problems with severe COVID and beyond are about immune hyper responses. It's not the virus, it's the immune system targeting virally infected cells, being triggered with autoimmune responses that runs into this risk of causing organ damage. This really is the critical part of what is going on. And I think that we need to get that in our heads because without that understanding, nothing makes sense. I keep saying to people, it's not whether or not someone has been vaccinated or not vaccinated. It's whether or not they're getting systemic responses with spike protein from the virus getting into their bloodstream. They usually feel unwell for longer. They usually have lots more symptoms. You'll notice things like their blood pressure going off, They will have lots of gut intestinal symptoms. All of that indicates that the virus has broken through the castle wall. That's the point. If it can only get to the wall and not get inside, there is no problem. But once it gets inside, even if you fight it off, you're damaging within the castle all the time. That's the problem. That's the bit that a lot of people don't quite get. So, what I say is that when we look at the pathology of what's happening and how disease is presenting now, that to me suggests that this is where we're going. So, if you look again back at what's happening here, I'm just going to make it a little bigger so that you can understand it better. When we look at this here, this is what we're seeing in cohorts who are age 45 to 59. Their blood pressure is going off, their kidney function is going off. These are the factors that create the issue. And this is what we have to mitigate. When you look at older age groups, 60 to 74, myocarditis, that suggests that the virus has broken through and is inside the castle, damaging the heart. When you look at the very old age group, 300% increase in myocarditis. So, all of this is pointing to the fact that systemic responses inside the castle are causing the challenge that we're seeing now. That's the point that I'm making. And that's why I'm concerned. I actually recently said that the outbreak of hantavirus on the cruise ship, I made a speculative, scientifically thought through comment that there is a strong possibility that they had an outbreak of COVID before the presentation of hantavirus. That's my instinct. I don't have any facts on that, but that would be the question that I would have. Recently, when I covered Kyle Bush, he had a sinus infection 2 weeks before. I would bet that's going to be some kind of COVID presentation. We are seeing it over and over again, but there is no interest in looking at this. We can speculate why there is no interest. I think the public are tired of it. They don't want to hear about COVID anymore. They want to move on. Science wants to move on because if you question COVID, you have to look back at the actions in the pandemic. They don't want to go back there. And so there is almost an agreement between the public and the scientific community. Let's move on. That's the problem. There is no moving on because the implications are still occurring no matter what we do. I don't think, from a scientific point of view, it is in anyone's interest to ignore the pathology that we may be seeing. I think we all have a responsibility not to stick our heads in the stand and certainly not to let the scientific community get away with saying there is no issue. We need answers. We need them now. We need them quickly. But sadly, we may have been gone past the point of mitigation. Have a great evening, and thank you for staying with me on this point.